I'm Dylan Babb, an advanced care planning facilitator.
And I'm Sharon West, registered nurse.
In this video, we're going to walk you through the steps for completing an advanced directive for the state of North Carolina. An advanced care document sets up your guidelines for who you want to make decisions or choices for you when you can't. It also sets up how you want those decisions made.
Before you fill out this form, you should take the following steps. Talk with the person that you want to name as your healthcare agent. This is the person you have picked to make health decisions for you. Make sure they are willing to act as your agent and that they fully understand their duty to respect your wishes about your medical care. Talk with your healthcare provider, your doctor or nurse about any concerns you have regarding the kind of care that would be right for you.
It's important to remember that this form is just one step in the process of advanced care planning. Throughout your life, you will need to continue to have conversations about your values, beliefs, and goals for how you wish to be treated when you can't make the choices yourself. Over time, your wishes may change, and you may need to update this form. If at any time during this process you are confused or have concerns, it's okay to stop and talk to your healthcare provider and your agent.
It is recommended that you reevaluate this form when you have a significant change in health or your family. You may want to consider reviewing every 2 to 5 years. In order to make the form official, you will need to have a notary and 2 witnesses. The witnesses should be over 18. Your agent, your healthcare provider, or a relative cannot be witnesses.
This form has 3 parts, Part A, B, and C. You may complete Part A only or B only, or you can complete both. In order to make this form legally effective, you must complete Part C.
Part A is the healthcare power of attorney document, and it allows you to name your healthcare agent. This person may also be called a healthcare proxy or a healthcare agent. Your agent should be over the age of 18 and should not be someone you pay for healthcare. This person will only be able to make decisions on your behalf if your doctor determines that you have lost the ability to make your own healthcare decisions. You do not have to complete the healthcare power of attorney to complete the living will in Section B. To begin, print your full legal name and date of birth on the first line. In Section 1, you will write the name of the person you choose as your agent. Please include their first and last name, along with their address, home phone, cell phone, and email address. You will want to make sure that the person you are choosing can be reached by the medical providers. In case your first choice is unavailable to serve as your agent, you may want to name a backup choice. Please include their first and last name along with their address, home phone, cell phone, and email address. Look back on the contact information for your healthcare agent and your secondary agent. Is all the information up to date, and is it correct? In Section 2, you have the opportunity to include any special instructions that you want your agent to follow. You can also include any limitations that you want to put on your healthcare agent. You may want to review the responsibilities of your healthcare agent as described on page 1 of this document set. You can include any information about your values or beliefs that are important to you. You will get a chance to include some of this information in your living will. You can leave this section blank for now and return to it after you have completed the living will. In Section 3, you can give your agent special information about organ donation. You must initial on the line if you want your agent to be able to donate your organs or tissues.
Part B is a living will form. A living will is your opportunity to voice your wishes for the kind of medical treatment that you would want if you were unable to communicate. It is a document that your healthcare agent and your medical providers can use to guide their decisions. If at any point you have questions about this section, it's important to stop and talk to your healthcare provider and your agent about your concerns. If you do not wish to complete a living will, you should initial at the top of the page and strike through the text. You can move to Section C. You do not have to complete a living will to complete the healthcare power of attorney. On the first line, write your full legal name and your birthday. In Section 1, you will review 3 scenarios in which you will be unable to communicate your healthcare decisions. When reviewing the scenario, you should initial on the blank line if you do not want life-prolonging measures. If you do want life-prolonging measures, if you have this condition, then you should leave the line blank. In Scenario 1, you have a condition that cannot be cured and will result in your death within a relatively short period of time. In this scenario, you are unable to communicate to your medical providers, and your agent and providers will need to refer to this document. Initial here if you do not want life-prolonging measures under these conditions. In Scenario 2, you have become unconscious and your doctors have determined to a high degree of medical certainty that you will never again regain your consciousness. If you are unable to communicate your wishes, initial here if you do not want life-prolonging measures under these conditions. In Scenario 3, you suffer from advanced dementia or any other condition that results in the substantial loss of your ability to think. Your doctors have determined to a high degree of medical certainty that it is not going to get better. Initial here if you do not want life-prolonging measures under these conditions. Putting your initials next to these scenarios does not mean that you will receive no treatment. Your medical providers will continue to make sure that you are kept as comfortable and pain-free as possible. Review the scenarios and initial situations in which you would not want life-prolonging treatment. In Section 2, you have the option to indicate your preference regarding artificial nutrition and hydration. Initial on this line if you do want tube feeding. If you do not want tube feeding, leave this section blank. If you think that you want artificial hydration and nutrition, even when they may not be curative, initial this section. In Section 3, you indicate that you wish to be made as comfortable as possible. You do not need to initial this section. Please make sure that you have discussed this with your agent and your provider. In Section 4, you are giving permission to your healthcare providers to refer to this living will in order to withhold or discontinue life-prolonging measures. You do not need to initial this section. At this moment, you should pause and review the document. Is there anything important to you that is not included in the living will? If you would like to add anything, then return to Part A and write your instructions for your agent in Section 2. If you have no special instructions, please draw an X through Section 2 in Part A. You are ready to finalize the living will. Pause and return to Section 5 in Part B. In Section 5, you can limit the power of your healthcare agent or limit the power of the living will. If you have appointed a healthcare agent and that agent gives instructions that differ from your desires expressed in this living will, then your providers should either follow the living will or follow the instructions of the agent. You may choose only one answer. There is no right or wrong answer here. Please indicate your choice of the living will or the agent by initialing on the line. Again, you may only choose one. Take a moment and review your choices with your healthcare provider and your agent.
Part C is the signature and notary page, and makes your advance directive a legal document. You will complete this portion of the form in the presence of 2 witnesses and a notary. Do not sign it before you see the notary and the witnesses. The witnesses cannot be related to you by blood or by marriage. They cannot be your heir or a person named to receive a portion of your estate. They cannot be your doctor, healthcare provider, or an employee of the hospital where you are a patient. They cannot be an employee of the nursing home or adult care home where you live. In the presence of witnesses and the notary, you will complete Section 1. You should write today's date and sign. In Section 2, you print your name as the person completing the form. Now, hand the form to your first witness to sign and date. Hand the form to your second witness to sign and date. Section 3 is completed by the notary.
You've now successfully completed the advance directive. You should make sure to give a copy to your healthcare provider to include in your medical record. You will also need to give a copy to your healthcare agent. Store this document in a place that both you and your agent can access. You've made a great step in ensuring that your future healthcare will reflect your values, wishes, and goals. If you have any questions about this document or advanced care planning, contact your doctor's office, hospital, or local hospice.